Antimicrobial resistance, or AMR, is undermining healthcare globally, making many antibiotics and other medicines on which we depend less effective. Routine infections are becoming harder to treat, debilitating, or deadly. Every year, AMR contributes to nearly 5 million deaths, and without urgent action, that number will only grow. World AMR Awareness Week helps us spread the word about the concrete actions needed to tackle AMR. This include preventing infections, using the right medicines the right way, developing new antibiotics, and reducing the unnecessary use of antimicrobials in healthcare, agriculture, and food production. Stopping AMR is a shared responsibility. Let's work together to protect the medicines that protect us.
While pandemics like COVID-19 shock the world visibly, another slower, deadlier threat is emerging beneath the surface: antimicrobial resistance. The World Health Organization (WHO) has labeled it one of the top 10 global health threats of our time. Without urgent intervention, experts warn that antimicrobial resistance could kill up to 10 million people annually by 2050, surpassing deaths caused by cancer. Antimicrobial resistance occurs when bacteria, virus, fungi, or parasites evolve to resist drugs designed to kill them. This makes infections harder and sometimes impossible to treat. Hospitals worldwide are reporting a rise in superbugs resistance to multiple antibiotics. The overuse and misuse of antibiotics in humans, livestock, and agricultural main drivers. In many developing countries, antibiotics can still be bought over the counter without prescription, making a regulation nearly impossible. We are entering a post-antibiotic era, warns Dr. Michael Gaite.
We're going to get ill and die of resistant infections, but also in animals, and that has huge agricultural costs. And then there's the risk of zoonotic infection spreading from animals to humans.
Antimicrobial resistance is not just a human health issue, it's an ecology one. The One Health framework integrates human, animal, and environmental health to combat the spread of resistance. Wastewater contamination, unregulated hospital effluents, and agricultural runoff all contribute to resistant bacterial strains. Ethiopia is partnering with India and other nations through joint research program to monitor cross-border antimicrobial resistant trends and strengthen laboratory capacities. An epidemiologist, routine surgeries, children, or even minor infections could become life-threatening. In Africa, the situation is especially there. Weak surveillance system, limited diagnostic tools, and counterfeit medicines worsen the crisis. Ethiopia, Nigeria, Kenya are among the countries now implementing national action plans on antimicrobial resistance support by African antibiotic misuse in 16% community pharmacies surveyed. Farmers commonly use antibiotics to speed up livestock growth, creating reservoirs of resistance that spreads through the food chain. Globally, antimicrobial resistance threatens to trigger an economic downturn similar to 2008 financial crisis. The World Bank projects that unchecked antimicrobial resistance could reduce global GDP by 3.8% by 2050 and push up to 28 million people into poverty, especially in lower-income countries. The African Health Communications Fellowship 2025, co-led by public health experts from Ethiopia, is raising awareness about responsible antibiotics use through multimedia campaigns, documentaries, and community dialogue. Public education is key, say Taizaru, a One Health advocate. People must understand that antibiotics are not a cure for everything. Each misuse today means one less treatment option tomorrow.
መድኃኒት የተላመደ ጀርሞች እንደ ዓለም በጣም ከፍተኛ የጤና ችግር እያስከተሉ ነው። ለዚህም የዓለም ጤና ድርጅት በ10 የመጀመሪያ ቅድሚያ የሚሰጣቸው የጤና ችግሮች ውስጥ አንዱ መድኃኒት የተላመዱ ጀርሞች እንደሆኑ በመረጃ አስቀምጧል። ስለዚህ በዚህ መሰረት እንግዲህ በዓለም ላይ በየአመቱ 700,000 ያህል ሰዎች በዚህ በመድኃኒት በተላመዱ ጀርሞች ይሞታሉ። ይህም ማለት እንግዲህ በየደቂቃው አንድ ሰው በደቂቃ አንድ ሰው ይሞታል ማለት ነው። እንደ በ2022 በተጠና ጥናት መሰረት ደግሞ በ2050 ይህንን ችግር በትክክል ማስቆምና አፋጣኝ ምላሽ መስጠት ካልቻልን በ2050 ወደ 10 ሚሊዮን የሚደርሱ ሰዎች በዚህ ችግር ይሞታሉ ማለት ነው።
Antimicrobial resistance is the world's next great health emergency, an invisible pandemic that could undo decades of medical